Meantime, medical resources are being focused on the national scale, but a well-known Tucson doctor has experienced in just that sort of challenge. 9 on your side's Craig Smith talked with former U.S. Surgeon General Dr. Richard Carmona. Craig?
Dr. Richard Carmona has a deep understanding of the public health challenge coronavirus presents. President George W. Bush appointed him U.S. Surgeon General. Dr. Carmona spent 4 years in that post. Before that, he developed a lot of the public health system that serves Pima County today. We will show a condensed version of our interview with the doctor. One of our first questions was, how are we doing as the government and the public?
Well, I'd say we're struggling right now. I think that the messages coming out at the federal level have been confusing because a lot of politicians are giving messages, and I think the public would like to be reassured from a physician or a scientist who's expert in the field. This is a health issue. It's not a political issue. We're talking about people's lives. It is our job, and me as a Surgeon General, when I would speak about these things, it was my obligation and opportunity to translate complex science into something that's easily understandable. We call that health literacy, so that then the person armed with that information will make prudent decisions for them and their family. But it helps when that information comes from a trusted source where there's not perceived to be ulterior motives, political motives especially. It's new and different, and because it's new and different, why we call it a novel virus, because your body hasn't seen it before. It hasn't been out there. So people don't have antibodies. So you get challenged. Now, if you're a healthy person, you'll get a little fever, you'll cough, you'll sneeze, you may get GI upset, but in a week or two, you're going to be fine. The vulnerable population is what we worried about, because when you're living on the edge, you already have cancer, you have AIDS, you have chronic diseases that require a lot of medications that suppress your immune system. There's where the vulnerability is. So the idea is, let's be smart, limit as much as you can those contacts, and practice good public health, especially hand washing when you sneeze, you cough, tissue into the fold of your arm, things like that, to limit the exposure by everybody. If we all do that, we can help to ensure that this virus dies out sooner.
Dr. Carmona says with conflicting and often wrong information flowing so freely, it's important to choose a few sources that are credible beyond dispute and stick with them for coronavirus information. He especially recommends the site from the CDC, the Centers for Disease Control. Craig Smith, KGUN 9 on your side.